Health Sciences at Drake University, and I am very excited to meet with you all tonight. First off, I do want to ask that if you cannot hear me, please leave a comment in the chat box. That will let me know whether or not the sound is good. I do want to make sure you all are aware, I do have a colleague in the room with me. His name is Evan Favreau from the Office of Admissions, and he'll be helping me answer questions in the chat box towards the end of the presentation, and so he'll be joining us tonight. All right, so we are here tonight to talk about the Drake Pre-Pharmacy program. Those of you who are in the room tonight are admitted students into the program. So first, I would like to be one of the first people to congratulate you on your admission into pre-pharmacy. That's a great honor, and so congratulations to all of you. Tonight we'll be talking about several different aspects of the program. We will be talking about some of the different career pathways and opportunities that our students pursue and take advantage of while they are here in the college and in the program. We'll also be talking a little bit about the Drake PharmD Difference, which are the benefits of being a pre-pharmacy student. And then we'll wrap up with some of the opportunities to add some value to your degree. We'll include some of the joint degree programs. We'll talk a little bit about international study and study abroad, and also some of the opportunities for practical experience in the program as well. So to get started, I would actually like to begin with a brief video. This is also something that you are welcome to go back and view on our College of Pharmacy and Health Sciences website later on. But the video that you're about to see is a little bit of an overview of the pharmacy program here at Drake, and it's told through the eyes of students and faculty here in the college. So we will talk a little bit more about the details of the program after the video, but I think our faculty and our students can really tell you about their experiences from their own perspective and give you a really good idea of what you can expect as a student in pre-pharmacy.
At Drake University in Des Moines, Iowa, you'll find expertise and a passion for improving lives through the practice of pharmacy. Drake's PharmD program offers a tight-knit community where you can pursue your individual career goals.
That means that our students can look at paths that are interesting to them, explore them, and then gain enough expertise in those areas that they can actually be desirable when they graduate. That is something that you don't see in a lot of pharmacy programs. I think the hardest thing for our students is choosing from all the various paths that are available to them, because there are so many that they can follow.
Drake left an indelible mark in my life that I didn't realize necessarily until after I graduated. And I'm very grateful for that. The fact that the professors took an interest in you academically, but also personally. The fact that they celebrated with you and actually meant it. Is something that means a lot.
Pharmacy students aren't just gaining the skills they need today, they're learning how to affect the future of pharmacy. In state-of-the-art facilities, in academic competitions, in the community, Drake PharmD students are reimagining the industry.
Especially healthcare is going through huge changes. Hospitals, pharmacies, everywhere you look at healthcare, there are changes in the way things are being funded and the way practice is being done. And as a result, you need to have people who are really very nimble and able to look at the current situation, figure out what opportunities there are, what problems there are, and adapt to those situations. And that's what entrepreneurial leadership is all about.
So the lab that we're in right now is called the Davidson Lab, and it's an actual pharmacy, so it's licensed as a pharmacy. What this allows students to be able to do is mimic what a real pharmacy would be like. They're able to process prescriptions, check those prescriptions, counsel patients, and really allows them to practice as much like a real-world situation would be as possible.
Drake student pharmacists tend to always have a great understanding of the healthcare system. I think they really are understanding where the healthcare system's going, where the profession of pharmacy can fit in, and being able to communicate that. I really feel like the communication skills that Drake students have really are top-notch.
Located in the state capital, Drake students have ample opportunities for gaining hands-on experiences. Those opportunities extend beyond Iowa, across the nation, and around the world.
I really love the hands-on patient contact that we get to have. We have experiential hours that we have to perform, so many per year, and we get to travel to various locations. So I've been able to go to hospitals, I've been able to go and give health screenings, bone density, blood glucose, things like that. And it's been really fun to sit down and talk to patients and hear their side of what they think pharmacy is all about, and really get to know them on an individual level.
Drake will challenge you beyond anything you ever imagined you would be challenged by. But at the end of the day, you will grow more than you ever expected.
Pursue your dream of making a difference and leading innovation by exploring the Doctor of Pharmacy program at Drake University. Go to our website or schedule a campus visit.
Allows students. All right. Sorry about the feedback on that, but thank you so much to the students who let us know about that. I really want to apologize, but hopefully you enjoyed that video, and we'll talk a little bit more about the details during the presentation. So I did also forget to mention when we started that if you do have a question at any time during the presentation, I don't want you to lose your questions by waiting to the end, so please go ahead and feel free to type them in the chat box, and either Evan will answer them as we go, or we can also take a look at them towards the end as well. But we'll get your questions answered during this presentation as well, because your questions are very important to me, and I want to make sure that we cover information that you all are interested in learning. So the first thing I'd like to talk about tonight, as far as the program for pre-pharmacy, is why do students and why should you consider pursuing a career in pharmacy? One of the things that we find more often than not with our students and our graduates is not just having a love of science and being good at science. We do hear that a lot from students who are interested in the profession, but more so we're finding that in order to be a successful pharmacist and to be successful on the pathway that you would like to pursue within the profession, you need to have a desire to also help people. So pharmacy is one of those professions within healthcare that you really have the opportunity to make a profound difference in the lives of people, not just because you are the expert in their medications, but also because as a future pharmacist, you would be a person that they could go to with questions about pretty much anything related to their healthcare and healthy living. So being a pharmacist is a very respected position within the medical community, and even just within the community in general. One of the things that we do a lot in our college is take a look at data that's out there by different organizations around the country on different career pathways that students choose to take and how those pathways look through the eyes of the public. One of the things that we found is that pharmacists tend to rank very highly in polls that talk about careers having lots of public respect. A lot of times we're finding that pharmacists even outrank other types of healthcare professionals like doctors and surgeons. They have on occasion outranked teachers in the area of public respect, even some members of the clergy. So pharmacists are definitely the people in our community that we respect and trust to give us accurate information about our healthcare. Students who graduate from Drake's pharmacy program tend to be very, very successful in their search for the perfect job or the perfect residency. The accomplishment rate of our graduates is very, very high. As a matter of fact, for the last 30 or so years, we've been keeping track of this data since about 1984. And for about the last 30 years, we have been either at or very close to 100% accomplishment rate, meaning that 100% of our students are getting jobs within the field of pharmacy within 6 months of graduation. So that's something that we're very, very proud of, and it speaks very highly of the students that come through our program. The last thing I want to talk about regarding careers in pharmacy are all of the options that are available to you as a pharmacist. One of the things that I talk to students about all the time when I meet with them and their families, when they come here to campus, when I'm talking to them on the phone, is the opportunities within the profession of pharmacy are a lot more varied and diverse than most people out there really think. To tell you the truth, before I began working for the college, I was like a lot of people out there. I thought that the pharmacist was just the person, behind the counter at Walgreens or my local grocery store who gave me my prescriptions and sent me on my way. But after learning about the profession, after talking with our faculty and our graduates and seeing what our students do out there in their practice sites, people who study pharmacy and pursue careers in pharmacy have a wide variety of opportunities available to them. Most notably, our students tend to go into professions that focus a lot on patient care and being able to see patients on a daily basis or on a regular basis. A lot of times this does involve being in a community pharmacy, which would be what we would normally think of as a retail pharmacy setting. But it could also mean being an independent pharmacist and owning your own pharmacy. It could mean being a pharmacist in a clinical setting, maybe as part of a hospital medical team. Pharmacists work on pretty much every floor within a hospital, every wing, every department. They also work in the centralized pharmacies within hospital settings. Most of the time, these pharmacists are acting as consultants to the medical team. They are the experts on that team when they're doing rounds. They are the ones that know everything there is to know about their patients' treatments, medications, dosing. They're the ones that the doctors on the medical team will go to for advice regarding treatments and maybe new treatments that are out there for their patients as well. Other clinical areas that our graduates tend to get into also include private practice clinics. A lot of private practice clinics now are employing their own on-staff pharmacists, so that's also an area where students have some great career opportunities. Long-term care facilities, students who like working with an older population can get involved that way. And there are even specialties within pediatrics. Those of you who are interested in working with children might be interested in taking advantage of some of the opportunities we have to get you involved in pediatric pharmacy while you're a student here. So there are lots of clinical aspects to careers in pharmacy. But you don't necessarily have to be a community pharmacist or a clinical pharmacist to have a successful career in pharmacy either. There are some students out there who really like the business side of pharmacy. We send our students to observe and work in what we would call MTM centers, which are medication therapy management centers, and they work more on the administrative side of pharmacy, working with coordinating between pharmacies and hospitals and clinics and healthcare insurance companies and other entities throughout the healthcare industry to coordinate the care that patients get. So there are lots of opportunities within business. You could go into the pharmaceutical industry if you're a person who really likes research and wants to be part of developing new products or enhancing products that already exist. Pharmaceutical companies really like to hire people with PharmD degrees as part of their sales teams, marketing teams, customer service and support, public relations. There are lots of opportunities within the industry. If you like politics, government, regulation, education, there are lots of opportunities within regulatory pharmacy to get involved with advocacy, consulting on different healthcare reforms that are out there at the state level, at the national level. Lots of our graduates actually get involved in consulting for healthcare policy that is being written right now. As a matter of fact, we actually have an alum in the Iowa State Legislature currently who takes our students into his practice within government as an intern. So there are lots of opportunities there as well if you like more of the politics side of healthcare. So I really do think that there's something for everyone within the profession of pharmacy, and what we're here to do as the College of Pharmacy and Health Sciences is help you explore your passions and figure out how you want to make the most of your time here at Drake and your career after you graduate. So that's really, I think, the basis of what you'll find here is just a lot of opportunities to explore what you might be interested in and to master the skills and the attitudes that you'll need to be a successful pharmacist. I want to move in now to talk a little bit about the Drake PharmD Difference. As students who have been admitted to the pre-pharmacy program, you are going to reap the benefits of the Drake PharmD Difference once you get here to campus. As soon as you enroll in the pre-pharmacy program as a first-year student, you start having the opportunity to take advantage of some of these benefits. Really what the Drake PharmD Difference does for you, and this is a little bit different than what you might see at other schools of pharmacy. We're kind of unique in what we provide to students, but the one thing that I think is really important for our students to know is that as a pre-pharmacy student, you have full consideration for admission into the professional program during your sophomore year in the pre-pharmacy program. What that means is that having been admitted as a pre-pharmacy student, we have so much confidence in your abilities as a student and as a future pharmacist that we automatically want to interview you your sophomore year for admission into the professional program. We are automatically going to have you take the writing assessment that every applicant to our professional program takes. You do not have to be waiting to be invited to come to campus for that interview or to have an interview with our faculty. And that's different than how we work with our students who are applying from other institutions. We do have students that apply to our professional program from outside of Drake, but those students don't necessarily all get invited to campus to come interview. They have to be invited based on their grades, based on their PCAT score. You kind of have an in already with the interview committee because you are automatically going to be interviewing with them. So that's something that we are really proud of, the fact that our students in the pre-pharmacy program do so well in the admission process. And one of the reasons for that is because of your credentials coming into the program from high school. The next thing that we provide is a series of courses that you'll take throughout your first 2 years. The course is called CAPS, and that's an acronym. It stands for Career, Academic, and Professional Success. And the CAPS courses that you'll be taking each semester, your first 2 years, so you'll take a total of 4 of them, are really career exploration courses. All of those different pathways that we just talked about, that I went through really fast with you just a minute ago, you'll take 4 semesters to really dive in and explore each of those pathways in a lot more depth. We do that by bringing in speakers from different areas of pharmacy. We do that by sending you out into the practice sites to have observation and shadowing. You'll actually do 1 to 2 shadowing experiences minimum each semester. Actually, many of our students in the program decide to do more than 1 or 2 because they have so many interests and want to be involved in so many different areas of pharmacy, and they just want to learn about everything there is to know in the profession so that they can start deciding where to focus their energy once they're admitted into the professional program. These CAPS courses are they're the basis of your pharmacy education. They're the first pharmacy courses that you have the opportunity to take, and you take them before you're even admitted into the professional program. There are not very many schools of pharmacy out there that allow students who are not in the professional program yet to take pharmacy courses, but here in the College of Pharmacy and Health Sciences at Drake, we feel very strongly that if we can get you involved in the profession early on as a first-year student, as a sophomore, then you will be able to make some decisions about your own education with a lot more confidence. You'll be able to make some informed decisions, and you'll feel confident in the things that you are about to do as you're admitted into the professional program. The next benefit that we provide for our students in pre-pharmacy is the way we do advising here in the college. And if you have talked to your admissions counselor here at Drake before, or if you've been visiting with any other departments on Drake, you'll notice that this is not something that's special to the College of Pharmacy and Health Sciences. As a matter of fact, every department on Drake's campus does advising this way. We actually assign every single first-year student to a member of our pharmacy faculty, and that faculty member is your academic advisor for the duration of your time here at Drake. And we feel very strongly that that's the best way to do advising, because you are being advised and mentored by someone who's an expert in the field that you want to study. A lot of times you'll find that if you are looking at other schools, or if you're visiting with people from other schools, you may actually find that people who are enrolled in their pre-pharmacy program more than likely are not being advised by faculty members in the professional program. They're being advised by professional advisors, people who are generalists. They may not necessarily know a whole lot about pharmacy, just enough to help you understand what courses to take, but not too much beyond that. Sometimes these students are being advised by TAs or graduate assistants. With our program, we get you involved with the faculty right away. We want you to start building those really meaningful professional relationships with the pharmacy faculty. Faculty that you'll be taking courses with once you're admitted into the professional program, but you actually get to start a relationship with them in advising and mentoring before that even happens. And that's really great for our students, because they're the ones that are going to help you get connected in the profession. They're the ones that can provide advice for you on which electives are going to be the best for you to take for your career goals. Which practical experiences should you take advantage of to help you meet your aspirations and get on the right pathway for you. They're the ones that are going to take you to the national meetings and the state conferences and get you connected with professionals from all over the country who are going to open up opportunities for you for internships and summer opportunities, job opportunities after you graduate. So the faculty advisors for our program, the professors that advise our students, are instrumental in our student success. Now, even though I saved the next one for the fourth one on the list, sometimes this is actually more important than some of the others for our students. But as a student in the pre-pharmacy program, you do not have to take the PCAT during your sophomore year in order to be considered for the professional program. We do require students who apply from outside of Drake to take the PCAT. But as a student in the pre-pharmacy program, what we actually do for you is take your Drake GPA, and we use your overall GPA that you have in all of your courses, and we use a GPA that's calculated by your math and science courses that you're taking here at Drake, and that's how we consider you for admission, along with the interview and the writing assessment. We feel that because we know what the faculty in the chemistry department, the biology department, math, statistics, we have a very close working relationship with those departments. When they go through their curriculum review, we actually get to sit in on their meetings and help them decide what to teach in their courses. We get to tell them, what do our pharmacy students need to know prior to being admitted to the professional program to be successful? And they incorporate that into their classes. So you're taking the same biology, chemistry, math courses as other science students here on campus, but it's kind of nice because our pharmacy students set the bar for those courses. So we know that if you do well in your biology courses, you probably know something about biology. We don't need you to take the PCAT to tell us that information. You know, that's $200 on a test that you don't have to spend, and about 6 months worth of studying that you don't have to worry about. So we'd rather have you concentrate on studying for your courses during your sophomore year rather than concentrate on studying for that test. We have a lot of leadership opportunities within the college for our students through professional organizations, through professional pharmacy fraternities, through some of our state and national organizations. And our students are able to take advantage of those right away. As soon as they get on campus, we actually have an organization fair the first week. And anyone from first-year students through students in the professional program are eligible to become part of those organizations. So you may find that at some other institutions out there, you're not allowed to join any of the pharmacy organizations until you're actually admitted to the professional program. We have found that students who get involved early as first-year students or as sophomores have a much better understanding of the profession and are also more likely to be admitted to the program because you start getting involved in pharmacy-specific activities outside of your courses. So we always encourage our first-year students and our sophomores as pre-pharmacy students to get involved in those leadership opportunities. The last thing on the list is the Office of Academic and Student Affairs. This is the office that I come from, the admissions person in the college. That would be me. But we also have a director of student programs, and she helps students with more of the day-to-day operational things like adding and dropping classes, adding a concentration, or maybe picking up a minor. She can help you move the time of your lab if you need to. If you want to change who your advisor is, if you make a great connection with another faculty member in the college and you want to make that person your official mentor, she can help you with that as well. We also have someone in our office who is completely dedicated to career services. She helps students explore different career pathways. She puts on several different career events for students who are interested in internships. And she also puts on an event for our P4 students, which will be students in their last year of the professional program, for jobs and on-campus interviews. So there are a lot of opportunities there for you to have support from the Office of Academic and Student Affairs as well. I can see that we already have questions in the chat box. Thank you so much to Evan for answering those for us as we go. I will also have a question and answer portion towards the end of the presentation as well. So if you are still thinking of questions, please continue to type them in the box so you don't forget about them. Going along with the Drake PharmD Difference, I do want to talk a little bit about how students are considered for admission into the professional program during their sophomore year. As I had mentioned before, we use 2 GPAs to determine your academic strength. The first one is your overall Drake GPA, which includes all of the courses that you've taken here at Drake throughout your first 2 years. And the second is Math and Science GPA, which is comprised of the required biology, chemistry, calculus, and statistics courses that are required for admission into the pharmacy program. We also require our pre-pharmacy students to complete all of their required courses. You can actually find a list of those required courses on our website at drake.edu/cphs, and I will make sure to put that up on the screen towards the end of the presentation so that you can write it down. I know I personally am a visual learner as well as an auditory learner, so sometimes when someone says it, I don't remember it, but if I can see it, I have a much easier time remembering it. We give you the opportunity to show us your academic strength and complete your required courses in 4 semesters. So that would be your first year and the entire sophomore year. A lot of schools that take pre-pharmacy students don't necessarily admit them based on all 4 of their first semesters. A lot of pharmacy schools out there will only consider students on their first 3 semesters. So their first 2 semesters of the first year and their fall semester of the sophomore year. And at that point, those are the only grades that they consider. We think it's very, very important to also include the spring semester grades from your sophomore year because it gives us a full picture of who you are as a student, and it gives you the best opportunity to show us exactly how strong of a student you are. So having all 4 of those semesters included in the GPA calculation that we use is very important to us. Every single student that is interested in progressing to the professional program will go through a professional interview with our pharmacy faculty. You will also take a writing assessment. And the interview and the writing assessment help us assess how well you communicate with others, both your interpersonal communication and also through your writing. And one of the things that we're looking for in those 2 pieces are the seeds of communication and the seeds of professionalism. We want to make sure that those seeds have been planted in you throughout the first 2 years of your time here at Drake. We want to make sure that you are making the most of your first year and your sophomore year here at Drake by taking some writing intensive courses, by having the opportunity to speak and give presentations in front of groups. And so we kind of take a look at how you develop your skills within the first 2 years by interviewing you and giving you a writing assessment. Now, that's not to say that we expect you to be perfect, because no one is perfect, and the purpose of going through the pharmacy program is to perfect those skills, to master those skills. So what we want to see in the interview and the writing assessment are the beginnings of a great communicator, something that we can build on in the pharmacy program, something that someone who is, we believe, would have a lot of potential to be a great pharmacist. And that's why we admit students into pre-pharmacy, because we have seen through your credentials as high school students that you are the folks that have the potential to be successful in our admission process to the professional program. So that gives us the strength of your overall application. The 4 components, the 2 GPAs and the required courses, are the more objective pieces. The interview and the writing assessment are the more subjective pieces of that. Sorry, you'll have to excuse me. I'm getting over a cold. I know I'm starting to crack in my voice a little bit, but now I know that some of you are probably interested in some of our admission statistics. So I have included some of those here in the presentation. As you can see, our students in the pre-pharmacy program do very well in the admission process to the professional program. We have very high acceptance rates with our sophomores. You can see that the current P1 class, this would be the group of sophomores that went through the admission process last year. Very close to 3/4 of them were admitted into the program. It was a little bit more than 74% of these students were admitted into the professional program. The year before that, it was a lot closer to 86%. It was actually just over 86%. So the reason that I'm showing you these statistics is it's twofold. One of the things that one of the questions that I get from students who visit here to campus a lot is, what percentage of the students are accepted into the program? How many students do you accept? What's the magic number? And the answer to that is we don't really have one. We don't have a magic number. We don't have a quota. We don't have a certain number of students that we have to admit or that we only admit. We admit students based on the quality of their application, the quality of their academics, the quality of their interview, the quality of their writing assessment. If a student is qualified for admission into the pharmacy program, he or she will be admitted to the pharmacy program. We don't necessarily have a number in mind. Most of the time, that percentage is above 70%. As you can see from the past 2 years, it's been above 70%. The second reason that I'm including these statistics is to show you, and to kind of compare ourselves to other colleges of pharmacy. There are many colleges of pharmacy out there that admit a lot of students into pre-pharmacy. They enter a class of upwards of 300 students, sometimes even 400 students in their pre-pharmacy class, knowing that they only have maybe 100 spots open in their professional program. And that means that only 25 to 30% of their students are getting into the professional program. That's not very comforting, I think. That doesn't instill a whole lot of confidence in their admission process, the fact that only 30% of their own students are getting in. Since our numbers are much higher, that says a lot about the type of student that we enter into pre-pharmacy. So at the beginning of this presentation, when I congratulated you all on being admitted to pre-pharmacy, that means something. I was very, very genuine in that, because as you can see from these numbers, it's a big deal to be admitted into pre-pharmacy. We admit students into pre-pharmacy because we have a lot of confidence in you. We truly believe that you folks are going to be successful in the admission process. That you have the potential to be successful in the admission process. We're going to talk now, we're going to switch gears a little bit now and talk a little bit about the curriculum in the pharmacy program, the professional portion of it, the PharmD curriculum. As you have seen so far from the presentation, that the pre-pharmacy program is kind of a mixture of the foundational math and science courses that you'll be taking, your CAPS courses, and then you also have room to complete what we call the Drake Curriculum, or if you've visited campus before and met with an admissions counselor, you've probably talked about the areas of inquiry. The Drake Curriculum and the areas of inquiry are what we call our general education. It's what you'd find at most schools called general education. Once you're admitted into the PharmD program, the professional program, the curriculum switches to more of a focus on the knowledge and the skill sets that you'll need to be a successful pharmacist. We incorporate experiential opportunities throughout the entire program. So you'll be doing, you start your experiential actually before you're even admitted with the CAPS course and the shadowing that goes on in that course. But once you become a P1, you actually start being involved in the practice sites. Our practice sites are state-of-the-art. They are extraordinary, the places that our students get to go. Speaking of practice sites, let's talk a little bit about the practical experience. The introductory pharmacy practical experiences, you'll find that we use a lot of acronyms here in the College of Pharmacy. The profession of pharmacy as a whole is filled with a lot of acronyms. So the IPPEs, as we call them, the introductory pharmacy practical experiences, are the ones that you start with in your professional program. You'll be doing more than 300 hours in your P1 through P3 years, and they build on each other. The experiences that you'll have in these practice sites are phenomenal. Anything from working directly with patients to doing rounds with doctors and pharmacists in the hospital. We actually have some sites where our students go to experience nuclear pharmacy, which for anyone who's not familiar with nuclear pharmacy, it's actually working with all of the radioactive cancer therapies that are distributed throughout the state of Iowa. We have the only nuclear pharmacy site here in Des Moines, so it's kind of in your backyard. Our students go to research facilities where pharmacists are doing some pretty cutting-edge research in pharmacogenomics, disease prevention, and exercise prescription. They're also working on research with our faculty, including breast cancer research, Alzheimer's research, asthma, different types of antibiotics. And the practical experiences that you'll have through your P1 through P3 years are preparing you for your practical experience that you'll have during your P4 year, which we call rotations. The advanced pharmacy practical experiences are a set of 8 5-week rotations. So every 5 weeks, your P4 year, you'll rotate to a new site. And the difference between the first 3 years of your pharmacy program and the last year of your pharmacy program is that during the introductory experiences, you are still in class. You are taking classes here on campus, and you're integrating the information that you learn in those classes with what you're doing at the practice sites. The practice sites are actually very well aligned with the courses that you're taking so that they reflect the same objectives, the same goals of each class. So you can very clearly see a connection between the courses that you take that semester and the practical experiences that you're doing. So that's how it works in the introductory experience. Once you become a P4 and you're in the advanced experience, you're no longer on campus taking courses. You are now basically you're full-time being a student pharmacist. You spend 8 hours a day, 5 days a week in a pharmacy experience, whether it's a retail pharmacy, a hospital pharmacy, it could be an acute care clinic, it could be working with a mobile pharmacist who visits people in their homes. It could be someone who works with pediatrics. It could be someone who works on drug information database. It could be working with a pharmacist in a long-term care facility. It could be working with patients who are managing diabetes. On the next slide, we'll actually talk about some of our concentrations, and one of those concentrations is a diabetes care concentration. We have rotations that our students do specifically for helping manage diabetes in certain patient populations. You can go anywhere you want on your rotations. During the first 3 years, we tend to keep you close. We keep you here in central Iowa in the Des Moines area for your P1, P2, and P3 years because you're taking courses at the same time. We can't really send you to Chicago in the morning for an experience and then expect you back by noon that day to take class. But during your rotations in your P4 year, you can literally go anywhere. We have between 600 and 700 sites each year that our students can choose to go to. Here in the Des Moines area, we have hundreds of those sites here in Des Moines, but you don't have to stay in Des Moines for all of your rotations if you don't want to. You can go throughout the state of Iowa. We have lots of rural sites here in the state of Iowa, but we also have some great experiences in other cities like Cedar Rapids, Dubuque, Iowa City. You can go outside of Iowa. You can go to Minneapolis, Chicago, St. Louis, Kansas City, Omaha, and even outside the Midwest. We send students to different places in Texas, Southern California, the Miami area, Orlando. We go to Nashville and Memphis. We've been to the New England area as well, a couple sites in Boston and New York. We even send students to Hawaii and Alaska for their rotations. So during those 8 rotations, you can choose where you want to go, anywhere in the country. I always tell students, I've seen the list of rotations each year, and you can literally throw a dart at the map of the United States, and wherever that dart lands, you're pretty much guaranteed to have at least one rotation site that's close to that dart. So we really do. We send students all over the place, even internationally. International study is something that we'll talk about with our value-adding opportunities, but I'll just mention that as a student in the pre-pharmacy and the pharmacy program, you have opportunities to do study abroad as a semester-long experience in your sophomore year. You can do a J-term trip or a summer trip to different areas and do healthcare-specific studies. Or as a pharmacy student, and this is something that's only available to pharmacy students at Drake, you can go abroad and do a rotation in another country. You can practice pharmacy in another country, which is very unique. There are not very many schools of pharmacy that let their students travel outside their city, let alone outside the country. And there aren't too many industries out there. Pharmacy is very unique in that it lets students who haven't graduated yet, who haven't become licensed pharmacists yet, practice their craft under the supervision of a professional outside of the United States. So definitely something to consider as you're looking at different pharmacy schools. If you're interested in a study abroad experience and you would like that experience to be very specific to pharmacy, the opportunity to practice your profession in another country, seriously consider Drake, because that is definitely something that you have the opportunity to do here. Now, we just talked a little bit about the international experiences on this slide. I went a little bit out of order, but I do want to talk about our joint degree programs, our minors, concentrations, and some of the other opportunities that we have. I just realized as I'm watching and looking at the slide that I did actually go out of order. I talked about our leadership and organizations a little bit ago, and I also talked about some of the outstanding research that's going on here in the college as well. So we'll focus a little bit more on the first 2 points, I guess. Here in the College of Pharmacy and Health Sciences, our students in the pharmacy program can take advantage of joint degree programs, which means you have the opportunity to earn not just a Doctor of Pharmacy degree, but also another high-level degree at the same time. We have 3 opportunities to earn master's degrees. Students can earn a master's in business administration, an MBA. They can earn a master's in public administration, an MPA. They can earn a master's in public health, an MPH. And that's pretty unique because even though there are a lot of pharmacy schools out there that offer one of those joint degree options, the key word there is they offer one option. I haven't, in my research of different pharmacy schools, I have not seen very many schools out there that offer more than 1 or 2 master's degrees to go along with your doctorate. The fact that we have 3 master's programs and a law program for our joint degrees is very, very unique to Drake, that there are a lot of opportunities to take advantage of. And if you want to earn a master's degree along with your pharmacy degree, you can do that in the total 6 years that you were planning on spending here. You don't have to take any additional time if you don't want to, which again is kind of unique. There are many universities out there that offer a master's degree for a joint degree, but they force their students to take an extra semester, or even in some cases an extra year, to finish those degrees. And so as a student in our program, you are planning on spending 6 years here, going through pre-pharmacy for 2 years, and once you're admitted to the professional program, 4 years in the professional program. At the end of that 6 years, you could come out with 2 degrees, a doctorate degree, a doctor of pharmacy, and a master's degree. Now, if you are interested in the law option, I will say that that one does add an additional 2 years to the time that you would be here at Drake. So you would spend a total of 4 years instead of 6. But you're also earning 2 doctorate level degrees. The law degree is also a doctorate degree. And if you think about it, if you were to do those 2 degrees separately, you would actually spend 9 years in school. So our joint degree program with the law school is actually shaving a year off of the time that you would spend in school as a whole. So the joint degrees are definitely something that makes our program unique, and it definitely gives our students a high rate of success when they're looking to go on to residencies after they graduate or getting into those top choice jobs. Our students are not just getting jobs in pharmacy. Our graduates are getting their top jobs. They are the ones that are, our graduates are the students that are getting those manager, pharmacy manager jobs. They are the lead pharmacists on a medical team in the hospitals. They are definitely entering the profession above the entry level. So it's really a great opportunity. I did talk briefly about the diabetes concentration on the last slide when we were talking about the rotation sites. The diabetes concentration is something that's only available to our pharmacy students. It's not something that other students here at Drake can take. So that's a very unique opportunity for you to become an expert in diabetes management. Whether you want to work just specifically with that population of patients after you graduate, or if you're looking to have more of a general practice, we're seeing more and more patients come into doctors' offices and pharmacies and hospitals with issues related to diabetes. And so just having that knowledge of being an expert in diabetes management can really help you no matter what type of practice you decide to pursue. The 2 other concentrations that we have here at Drake are the leadership concentration, which is a great precursor to our MBA and our MPA programs, and the global and public health concentration, which is a great precursor to the MPH degree. So if you're interested in adding some things to your curriculum as a pre-pharmacy student, I would definitely consider adding a concentration. You can pretty much add any minor you want to the pharmacy degree. Many of our students add another science minor because you're already taking a lot of those courses anyway. Psychology tends to be a popular one, so does business. Entrepreneurship for the students who want to own their own pharmacy one day. I even have some students in the pre-pharmacy program right now who are music minors, so you don't necessarily have to add something that's science related. If you have a passion in another area, you can add that as a minor as well. It takes some planning, and you need to let us know if you want to do that so that we can help you plan your schedule. But the students right now that we have that are pharmacy, pre-pharmacy majors and music minors, they are getting all of the courses that are required of them and doing great in the program. So it's definitely something you can do. The last thing I want to talk about before we open it up for questions is being here in Des Moines, working and being a student at Drake, but also being a citizen and a resident of the Des Moines community. I like to call this the Des Moines Advantage. One of the things that we really pride ourselves on is having hundreds of practical experience sites within the city. I know that many of you who might be from small towns, you might be a little bit apprehensive about coming to a larger city like Des Moines. Many of you who might be from larger areas, some of the major cities in the Midwest or around the country, might be a little bit anxious about coming to Des Moines because it's smaller than where you're from. But I honestly would put the practical experience sites that we have here in Des Moines, I would put the number and the quality of those sites up against any major city in the country. I really, truly would. We are a center for healthcare here in the state of Iowa, and we are definitely The sites that we provide for our students have cutting edge pharmacy experience, research, technology, just anything you would want in a pharmacy practice site. All with the advantages of being in a smaller city. You can literally drive from one end of the city to the other in less than 20 minutes. It's kind of nice to be able to get around and not have to wait hours and hours for the train or the bus to take you places. Being in the capital city of Iowa gives us some great advantages as well. You heard me talk about the internship at the state capitol with our own alumni who's in the state legislature. That's not the only one. We have very, very close ties to the Iowa Pharmacy Association. They're right in our backyard. Their office is here in the Des Moines area, so you don't have to go very far to get involved with them. And they like to stay close to Drake. They definitely have some close ties with our students, and they provide a lot of good opportunities for our students to get involved in some of the more regulatory areas of pharmacy. And then also being in the central Iowa area, you have a good opportunity to work with a lot of rural populations as well. So those of you who might be interested in working with more of a small town practice, or maybe having more of a practice in a rural community, would have that advantage as well. You'll have to excuse me, my cold is catching up with me. You need to take 1 minute. I'm going to mute my mic so I don't blast you with a cough here. Just give me 2 seconds. That. But this was the last slide. So the difference here is Drake. There are tons of opportunities for you, and we would welcome the chance to bring you to campus and show you what Drake has to offer this spring. So with that, I know that Evan has been taking care of a lot of your questions in the chat box. I've been as I've been looking at the camera and reading the slides, I haven't really been reading through all of them, but I'm seeing a lot of great conversation going on over here. So
I can read some too.
Sure, that would be great.
One question is asking about kind of time management as far as participating in clubs and organizations outside of pharmacy. How easy is that to balance?
Okay, so the question is about time management, balancing your academics with being involved in clubs and organizations. This is something that we feel very strongly about, that our students do not only have time to study and do well in their courses, but have time to get involved. We, once our students are admitted into the professional program, and even as students in the pre-pharmacy program, when you get involved with organizations, we actually carve time out during the week for our student organizations to meet and to plan their events. It's that important to us that we don't have class within the college at that time, because we want students to be involved. Another aspect of that is a lot of our students, once they enter into the professional program, they work in pharmacies during the academic year while they're in class, while they're doing practical experiences, and that's also something that we encourage. A lot of pharmacy schools out there actually discourage that, and they don't allow their students to work in pharmacies during the academic year. For us, you working in a pharmacy during the academic year is another opportunity for you to be involved in the professional world of pharmacy. You are getting paid for an experience of working in a pharmacy, but you're also making some really great contacts within the profession. You know, the manager at your pharmacy that you might be working at as a student could potentially be your future employer. That person could give you a great recommendation for a residency. The fact that you can, and we encourage you to, work in a pharmacy during the academic year is something that's unique to Drake. Now, I will say that most of our students are not working a lot. I mean, they're only working maybe 5 to 10 hours a week, which, you know, that could be a few days, you know, a couple weekends maybe, but those hours are essential for you. I mean, they are definitely something that will give you some exposure to pharmacy, and they'll pay you to do it, that you may not necessarily get at other pharmacy schools. So, great question. We probably have time for a couple more.
There's a question about for pre-pharmacy students that are not admitted into the PharmD program. what are their options?
That's a great question. The question was about students who may not be admitted into the professional program as a sophomore while they're pre-pharmacy students. We do have students that are not admitted during their sophomore year, but we do have some options for those students. Most of the time, if a student's not admitted into the pre-pharmacy to the professional program, it would mainly be due to grades. The majority of students that aren't going to be admitted to the professional program this year are not meeting the minimum 3.0 required GPA by the end of their spring semester sophomore year. That's another reason that we give you 4 full semesters of grades that we consider. For the students that are not admitted into the professional program, what we typically do is give you a checkpoint during that spring semester so that you know before final admission decisions are made in June, you have kind of an idea during the spring semester of where you stand. And if it looks like you may not be one of the strongest candidates for us, then what we tend to do is meet with you here in our office, the Office of Academic and Student Affairs, and we'll talk a little bit with you about alternative pathways. If there is another major that you are considering changing to, if you are considering applying to any other types of healthcare professions. Some of our students are interested in reapplying to the professional program as a junior. And so we kind of talk through all of the different options so that if you're not admitted to the program in June, you know what your path is going to be from there. The last thing that we want to do is surprise you in June. Leave you stranded without a schedule, without a plan, without a path to take. That's not beneficial for anyone. So we try to meet with you early if we think that you might be a student who maybe doesn't have as good of a chance of being admitted. And we talk about some of the options that are out there for you so that in June, if you're not admitted, you at least have a plan to fall back on and something that will progress you towards a degree, whether it be a health sciences degree, a biology degree. If you're going to reapply again next year for the pharmacy program, we want you to be able to be confident in the decisions that you're making. So we try not to blindside you. We try to meet with you early on so that we can at least help you plan for all possibilities at the end of the semester. Do we have time for one more?
Yeah.
All right.
Do you just have any examples of specifically the PharmD and the law combination? What type of careers might someone
Sure.
with that?
Absolutely. That's a great question. I know that pharmacy and law is not for everyone, but when I find a student who's interested in that program, I always get so excited because the opportunities for a pharmacist who also has an interest in law are really, really great. The majority of graduates who have done the joint degree program with pharmacy and law have gotten into primarily patent law areas. Many of those graduates go on to work for pharmaceutical companies, working in product liability. They tend to help those companies get new products off the ground and go through some of the legal kind of hoops to get their new products approved by the FDA, go through all of the testing that needs to be done, all the legalities of getting that product off the ground. We have also had graduates go on with their joint pharmacy law degree to work in very successful careers within the government. Regulatory pharmacy can be a great career for someone with a joint law degree, especially if you're interested in the politics side of pharmacy, getting involved in not just consulting on different healthcare reforms, but also writing them and educating people about them. We have also had graduates of that program begin very, very successful private practices, whether they own their own firm or they join a private practice firm, and they have represented both healthcare professionals and patients on both sides of a number of different types of cases and suits. So for the pharmacy law option, if you are struggling between deciding, I know that there are students out there that are struggling between, do I do pre-pharmacy or do I go pre-law? I'm not really sure what to do. Just know that at Drake, you don't have to choose. You can do both here and be very, very successful.
There is a question about demographics of students within the PharmD program. It may not be info that you have on the top of your head, but would that be something that students could, if they wanted to email you?
Oh, absolutely. Let me go ahead and put my contact information up here on the screen. That way you can contact me if you have any other questions, questions that either we weren't able to get to here at the end of the presentation, or maybe questions that Evan might not have been able to answer in the chat box. I would be more than happy to take emails and phone calls from you about any questions that you have regarding the pharmacy program, the pre-pharmacy program, admission from the pre-pharmacy to the professional program, opportunities for our students, both in the practice sites and also joint degree options, international opportunities, anything and everything. I love tough questions, so please feel free to send them to me. All right. Well, I really do want to thank you all for joining us this evening. It was a pleasure meeting with you tonight and seeing all of your great questions here in the chat box. I'm so glad that you were able to take some time out of your evening to join us. And I really do hope to see you on campus this spring. If you haven't yet had a chance to visit us here at Drake, I highly encourage you to contact our Office of Admission and set up a campus visit, either during one of our on-campus admitted student days or as an individual visit when it's convenient for you. And just, I think I can add something here while we're on. I'm just going to add the College of Pharmacy and Health Sciences website to this. So you can visit us online and get some more information that way as well. So thank you very much to Evan for sitting in and answering those questions for us in the chat box. And have a great evening.